Thank you, Mr. Speaker. Mr. Speaker, when we took office in 2020 in the COVID-19 pandemic, immediately we honored our manifesto commitment and embarked on a path of restoration and development. The past 4 years has been nothing short of progress, nation building, recovery of our economic status, improvement of livelihoods for all Guyanese, and most of all, placing Guyana on the world map as one of the fastest growing economies in the world. Mr. Speaker, Budget 2025 was drafted under the theme, a secure, prosperous, and sustainable Guyana, because this is where we stand as a country today. We are heading in a direction that will ensure every Guyanese live a life of dignity, a life where we can build a solid foundation for many generations to come. Mr. Speaker, for the past few days, we have heard many recurring statements about this budget, and I quote, "This is for friends, family, and favorites. This budget has nothing for poor people," unquote, and the list goes on. Mr. Speaker, I wish to remind this August House that those lines define the former 𝐁𝐔𝐃𝐆𝐄 government. Since it was under their tenure, Guyana was thrown into dismal days. Our sugar workers and Amerindian brothers and sisters were placed on the breadline. When they lost their only means of income after being fired by the very persons who claim to love people. Mr. Speaker, it was under the 𝐁𝐷𝐿 that every Guyanese struggled to put food on their tables, clothes on their backs, send their kids to school as they buckled under heavy tax burdens and reversal of programs such as the Because We Care cash grant, amongst others. Mr. Speaker, they were their own favorites. So as soon as they took office, they increased their salaries for ministers by more than 50%, while the public servants looked on the sidelines, helpless, and continued to take home their meager wages and salaries. Mr. Speaker, it was the poor and ordinary man who got nothing under the 𝐁𝐷𝐿. And I did my research, and I'm still to find one measure that was implemented to place money in the pockets of the small man. Instead, do you know what I found out? I found out that even the man operating a donkey cart had to pay heavy taxes. The persons with a kitchen garden with more than 3 plants and multiple poultry animals had to pay taxes. These were the inhumane and callous measures meted to the vulnerable people of this country. Mr. Speaker, the PPPC government understands that it is the people of Guyana who place their confidence and trust in us, and that is why we will continue to deliver and stand to our commitment by delivering workable policies, plans, programs, and take strategic, tangible measures that will help sustain and develop our country. Mr. Speaker, we continue to boost all sectors by ensuring equitable budgetary allocations that will further support our growing economy. Multiple measures were created to help cushion the pockets of Guyanese. And, a lot of persons are saying there is nothing in this budget for anyone. But let me give you this scenario. And this is for everyone who is looking. We have the Richards family, comprised of 8 persons living in a 4-bedroom house, 2 old-age pensioners, a teenager who wrote 𝐁𝐔𝐃 and passed all his exams and is now desirous of pursuing a career in civil engineering at the University of Guyana. However, funds are a bit low on the side because mom and dad are expecting to welcome their 5th child, all while caring for a differently abled child who tragically lost both limbs in an accident some time ago. The other kids are all attending primary school and are currently preparing for NGSA. Mr. Speaker, this budget will afford and bring relief to this family by increasing old age pension for the 2 elderly persons, along with providing their 100,000 cash grant each. It will provide free university education for that teenager. Mom and dad are public servants and have received their salary increases along with their cash grant. Mom will be signing up for her newborn 100,000 cash grant. The primary school kids will each receive $55,000, and the differently able child will also receive his one-off cash grant along with his increase of PD of 22,000. Not forgetting the 10,000 healthcare voucher for every member of the family. Mr. Speaker, like this household, every other household in Guyana will receive same, whether you support the PPPC government or the 𝐁𝐔𝐃𝐄𝐓 coalition. This is the vision of our government. We create comprehensive measures to cater for every man, woman, and child. Mr. Speaker, as I turn my attention to health, it is important to note that contrary to all the negative comments that we've listened for the past few days against our healthcare system, it was under our government in 2020 when we took office, various discrepancies were discovered. There was no workable plan to protect citizens from the COVID-19 virus. Billions in expired drugs and medical supplies were discovered. No new hospitals or health centers were built. There were there were no new health policies in place. Mr. Speaker, today, we can boast of 6 new hospitals being constructed currently, one in Anne Regina, Diamond, Enmore, Bath Settlement, Skeldon, and very soon, right in Region 3, the Kentron Hospital will be completed and commissioned. Mr. Speaker, patients who need dialysis are able to access 600,000 cash yearly to help with treatment. Old age pensioners and school age children benefited from spectacles vouchers. Our women from ages 21 to 65 benefited from the cervical cancer testing programs by accessing screening vouchers. Mr. Speaker, Budget 2025 will see a continuation of massive development in this sector. As I turn my attention to region number 3, already a contract was awarded to construct a new West Emera Regional Hospital at a cost of $54.2 million. Mr. Speaker, this very hospital in 2024, we had 1,316 deliveries, of which 921 were normal deliveries and 395 were cesarean section. A total of 1,278 surgeries were also done in this year. We've also seen training of PCAs and CHW, which will definitely see an addition to our medical fraternity. Mr. Speaker, we have seen more specialty clinics being added to our regional and our district hospitals, such as Wakenham, Leonora, and Leg 1. We now can see clinics such as internal medicine, surgical, psychiatry, psychology, ENT, maxillofacial, angiology, amongst others. All of this helps, Mr. Speaker, to decentralize care, and as such, we have seen a decrease of referrals to GPHC and to the West Emera Regional Hospital. Mr. Speaker, as we focus a bit on education, our government remains committed in the delivery of quality education to every citizen interested in learning a skill or improving their academic life, and that is why the GOLD Scholarship has seen at least 20,000 persons benefiting from same, with 4,431 awardees from Region 3, and to date, so far, we have had 1,318 completed their studies. This includes certificate, degrees, and master's program, Mr. Speaker. Mr. Speaker, this tells us that our young people are making hay while the sun shines and are endorsing this initiative provided by our government, something that never existed before under the previous administration. Mr. Speaker, our children continue to benefit from the Because We Care cash grant, and this year, every school-aged child, both public and private, will receive $50,000 cash grant and 5,000 school uniform grant. That is a total of $55,000 per child. This is a manifesto commitment kept and delivered. Mr. Speaker, more of our teachers are being trained. This will afford them personal academic advancement, which will also see our children benefiting from the delivery of quality education. This is progress, Mr. Speaker. Mr. Speaker, there are other numerous infrastructural development happening in Region 3 at this moment. We understand that our people are our most prized possession, and we will continue to build and nourish the growth and well-being of the people of this country. Mr. Speaker, we can see the new Demerara Harbor Bridge, which will bring relief and solve the heavy traffic woes faced by daily commuters. Our farmers can now benefit from farm to market roads at the Parika Back Dam and Parika to Bendoff. Mr. Speaker, we have commenced the gas to energy project at Wales and the 0.6 megawatt solar farm in Leg 1. Vendors now they can ply their trade in a new Leonore market, and very soon will also be able to further expand their trade in the new Hydroni market. Mr. Speaker, in agriculture, we have constructed so far 62 shade houses and distributed planting materials to farmers. Our fishermen have also benefited from upgrading of their landing sites all across Region 3. Mr. Speaker, as time will not permit me to go forward into Budget 2025, I wish to encourage every Guyanese that at a time convenient to you, pause and reflect what life was like from 2015 to 2020. And take a look around you. You will see that the PPP government promised and we have delivered. You can trust us to continue on this pathway of development and progress. And to my fellow young people, it is important to note that you are living in one of the best times in Guyana's history. Make the best of every opportunity available and grow in every aspect of your lives. The PPPC government will return to government and continue to work assiduously towards the development of all of Guyana. Mr. Speaker, last but not least, I wish to thank the Honorable Dr. Ashni Singh, Senior Minister in the Office of the President with responsibility for finance, and his dedicated staff for crafting yet another people's budget which will continue to deliver equitable benefits for every Guyanese, irrespective of their race, religious background, or political affiliation. I therefore recommend this budget for passage in this honorable House. Thank you.
Thank you very much, Honorable Member Dr. Smith.